Joining us right now with some practical advice is licensed family practitioner Abe Malkin. He's the founder of Concierge MD Los Angeles. Abe, thanks for being with us.
Thanks for having me.
Okay, so the CDC says it can take 2 weeks after one gets a flu shot for it actually to start protecting you. Is it too late to get the flu shot?
Certainly not. We're still seeing quite a bit of flu out in the community at this point. This flu shot we've been using has been about 30% effective this year, which is why we're seeing so much flu in the community. However, even those who still get the flu after getting the flu shot have diminished symptoms. So a lot of the scary stories that you hear about complications of the flu are often in those individuals who did not get the flu shot. So just to repeat, it's really important to get the flu shot even this late in the season.
Now, I've also heard some stories about the fact that the flu shot this year maybe is less effective than it has been in other years. And I can see that being, preventing some people from going to get. They might say, well, if it's only 10% effective, what good is it going to do me? What do you say to those folks?
Yeah. This strain of the flu, the H3N2 strain that we're seeing, in the Southern Hemisphere, which had their flu season before we in the U.S. have our flu season, we saw about 30% effective rate. So I agree it is quite a bit lower than in the past. However, as I mentioned, even those who are still getting the flu, even after getting the flu shot, the symptoms are far less severe. So a lot of the complications that end up in people being hospitalized, you're not seeing in the population of people who get the flu shot. So I would say to those people, even if you still do get the flu, you're much less likely to end up in the hospital from it.
All right, that's a good point and something that everybody at home needs to hear about, including this guy who might be guilty of that same kind of thing. All right, we put up a chart, Dr. Malkin, in the beginning of this, but it shows the number of flu-related hospitalizations this season versus past season, and it's showing a much more rapid increase than previous years. The hospitalization rate is the highest ever recorded at this point in the flu season, according to the CDC. In fact, we just surpassed the lethal 2014-2015 season, during which 710,000 Americans were hospitalized and 56,000 died. When you look at the hospitalization rate, what does that tell you about this particular strain of flu?
So what happens is when someone gets the flu, they start developing symptoms, cough, upper respiratory symptoms, perhaps nausea, vomiting. And if you're not really on top of it, you may lead to dehydration from the vomiting or the diarrhea, also upper respiratory complications like shortness of breath or wheezing in those who are particularly at risk. So this year, more than in previous years, we're seeing these secondary infections following the flu, such as bronchitis, sinus infections, ear infections, and pneumonia. So the fact that so many people are being hospitalized leads to the conclusion that we're seeing a far greater number of secondary infections following that initial flu infection.
I know we have a lot of parents, a lot of grandparents watching at home. I've got 2 kids that are in school. This scares me a lot. But in fact, in January, there was one school district in Florida that closed down for an entire day, I guess, or they shut the whole school district down because parents were concerned about their kids. What do you tell parents or grandparents that might be sending their kids to school? What advice do you give for them in this situation?
You mentioned 2 very at-risk populations. Certainly children under the age of 6 and elderly patients older than 65 are the 2 most at-risk populations. So for those in particular, it's really important that you still can get the flu shot even this late in the season. We may see the season progress until March or April. So that's number 1, get the flu shot. Number 2 is use good sanitary precautions, hand sanitizer, wear a mask if need be. Really voice your concern if you see others at school who are coughing and having symptoms, that maybe they need to go home and, not put others at risk. And then thirdly, I think taking supplements for your immune system like zinc, vitamin C, B12, these are all really great to keep a healthy immune system. And then, as always, just general health.
All good stuff.
Like get 8 hours of sleep and, stay well hydrated.